Did you know that the number of pillows you sleep with could be an important clue to hidden heart disease? Or that your eyes, your skin, your ankles, your pulse, and even your fingernails can reveal vital information about what is happening inside your heart? Heart disease is something I diagnose, treat, and think about every single day, and it is far more common than most people realize. In fact, many adults over the age of 40 are walking around with early heart problems, silent artery disease, rhythm problems, or warning signs they have never connected to the heart. You heard that right. A person can look fine. They can go to work, they can shop for groceries, they can walk around the neighborhood, they can even say, "I feel pretty normal." And still, their heart may already be struggling in ways they do not recognize. That is what makes hidden heart disease so dangerous. It does not always announce itself with crushing chest pain. It does not always begin with a dramatic collapse. Often it begins with small clues: one extra pillow, a tighter shoe at night, a pulse that feels uneven, a breathless moment on the stairs, a yellow patch near the eyelid, a change in the shape of the fingers. Tiny signals that seem harmless until you understand what they are trying to tell you. Today, I'm going to show you 7 hidden signs of heart disease that could help save your life or the life of someone you care about. These are signs you can look for right now. They are the same clues I look for when assessing my own patients. You do not need to be a cardiologist to notice them. You only need to know what to look for. I am Dr. William Lee, and before we begin, please tap the like button if this kind of practical health information is useful to you. Subscribe if you are new here, and leave a comment below telling me your age and which of these signs surprised you the most. Your comment may help someone else take a warning sign seriously before it becomes an emergency. Now let's get started. Number 1. How many pillows do you sleep with? This might sound like a strange question, and when I ask patients this, I often get a laugh. They look at me like I am asking about their mattress instead of their heart. But I have found that this is one of the most useful questions for identifying hidden heart failure. What I am really asking is this: can you lie completely flat and breathe comfortably? Or do you become short of breath when you lie down? Because that difference matters. The heart's job is to pump blood from the lungs to the rest of the body and then help keep that circulation moving back again. When the heart starts to struggle, blood can begin to back up into the lungs. As that pressure builds, fluid can leak out of tiny blood vessels and collect inside the lung tissue. When you are standing or sitting upright, gravity helps keep some of that fluid lower in the lungs. But when you lie flat, that fluid spreads more evenly. Suddenly, breathing becomes harder. The lungs feel heavier. The chest feels tighter. You may feel like you need to sit up just to get a full breath. It is almost like trying to breathe with a thin layer of water inside the lungs. This condition is called pulmonary edema, and one of the classic symptoms connected to it is called orthopnea. Orthopnea simply means shortness of breath when lying flat. The tricky part is that this usually does not happen overnight. Most people do not suddenly wake up one day and say, "I have heart failure." Instead, they make small adjustments. One pillow becomes 2. 2 pillows become 3. Then they start sleeping in a recliner. They tell themselves it is just more comfortable. They blame age. They blame acid reflux. They blame their neck. They blame the mattress. But sometimes the real reason is that the heart is not moving blood forward strongly enough. So here is the question I want you to ask yourself tonight. Could you comfortably sleep completely flat? Could you lie on your back without feeling air hungry? Or do you need multiple pillows just to breathe easily? And here's another clue. Do you ever wake up suddenly in the middle of the night gasping for air? Do you have to sit on the edge of the bed for a few minutes before you feel normal again? That can be another warning sign that fluid is backing up when you lie down. If this is happening to you, do not ignore it. It does not automatically mean heart disease, but it is important enough to discuss with your doctor. Number 2, can you climb a flight of stairs? Again, this sounds like a very simple question, but simple questions often reveal the biggest clues. Many people with heart disease feel completely normal during easy daily activities. They can walk around the house, they can go shopping, they can cook dinner, they can take out the trash. Some can even walk a mile on flat ground and tell you they feel fine. But stairs are different. Walking uphill or climbing stairs places a much greater demand on the heart. Your muscles suddenly need more oxygen. Your heart has to pump faster. Your blood vessels have to respond quickly. Your lungs have to keep up. And if there is a problem hiding in the system, stairs often reveal it first. So ask yourself this: can you climb one flight of stairs the way you used to? Or do you now reach the top and need to stop? Are you unusually short of breath? Do you feel chest pressure? Do you feel a heaviness in the arms, jaw, neck, or back? Do you feel lightheaded? Do you need to pretend you are stopping to check your phone just so no one notices you are winded? That last one is more common than you think. Patients often unconsciously adapt to symptoms. They walk slower. They avoid hills. They park closer. They take the elevator. They ask someone else to carry the laundry basket. They stop doing the things that expose the problem. And because they adapt gradually, they do not realize their heart capacity has changed. That is why I always care about change from your normal. If you have always been short of breath on stairs, that is one thing. But if one flight of stairs used to be easy and now feels like a workout, pay attention. Sometimes the earliest signs of heart disease only appear when the heart is pushed a little harder. Number 3, are your ankles swollen? This is one of the easiest signs to check yourself, and it is one people overlook every single day. Sometimes all you notice is that your shoes feel tighter in the evening, or your socks leave deep marks around your ankles, or your lower legs look puffier at night than they did in the morning. You may press your finger into your shin and notice the skin does not spring back right away. What we are looking for is something called pitting edema, and you can test for it right now. Press firmly on your ankle or shin with your thumb for about 15 to 30 seconds. Then let go. If a dent stays in the skin for a few moments, that is called pitting edema. What you are seeing is fluid that is leaked out of the blood vessels and collected in the tissues. And one reason this can happen is that blood is backing up because the heart is not pumping effectively. Think of circulation like a loop. Blood has to move forward through the arteries, then it has to return through the veins. If the heart is weak, or if pressure builds inside the system, fluid can collect in the lowest parts of the body. And because gravity pulls fluid downward, the ankles and feet often show it first. Now, swelling does not automatically mean heart disease. It can happen with kidney disease. It can happen with liver disease. It can happen with vein problems. It can happen from certain medications. It can happen during pregnancy. It can happen after sitting too long. But swelling becomes more concerning when it appears with other clues: shortness of breath, fatigue, trouble lying flat, rapid weight gain, a cough at night, or a feeling that your legs are suddenly heavy and tight. Here is a practical detail. If your ankles are swelling, pay attention to whether both legs are swollen or only one. Both leg swelling can fit with fluid overload or heart failure. One leg suddenly becoming swollen, painful, red, or warm can be a different emergency, including a possible blood clot. That needs urgent medical attention. The point is not to panic. The point is to notice the clue and get it evaluated. Number 4, is your pulse regular? There's a heart condition you can screen for right now using nothing more than your fingers. Place 3 fingers on your wrist, just below your thumb. Press gently until you feel your pulse. Now pay close attention to the rhythm. Not just the speed, the rhythm. Does it feel steady and regular, like a drum beat? Or does it feel random? Fast, slow, pause, jump, pause, beat, 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 then another pause. If your pulse feels completely irregular, you could be experiencing a condition called atrial fibrillation. Many people call it AFib. The heart has 4 chambers, 2 upper chambers called atria, 2 lower chambers called ventricles. Normally, the electrical system coordinates the chambers so they beat in an organized rhythm. But in atrial fibrillation, the atria start firing chaotically. They quiver instead of squeezing properly, and that can create an irregular pulse. Some people feel it as palpitations, some feel fluttering, some feel pounding, some feel fatigue, dizziness, or shortness of breath, and some feel nothing at all. That last group is why this matters so much. AFib can be silent. A person may not know they have it until a stroke happens. Here is why it is dangerous. When the atria do not squeeze properly, blood can pool inside them. When blood pools, clots can form. And if a clot leaves the heart and travels to the brain, it can block blood flow and cause a stroke. Atrial fibrillation can also contribute to heart failure over time because the heart is not pumping as efficiently as it should. The good news is that many modern smartwatches can detect irregular rhythms and alert you, but sometimes your fingers can pick it up first. If you notice an irregular pulse, especially if it happens repeatedly, do not just assume it is stress or caffeine. Make an appointment. Ask whether you need an ECG. Ask whether you need longer rhythm monitoring. This is one of the signs where early detection can completely change the outcome. If you are finding this video useful, please subscribe and leave a comment. I make these videos to share practical medical knowledge that anyone can use to live a longer and healthier life. And sometimes one small clue is all it takes to push someone to get checked in time. Number 5. Watch your neck and fingernails. The heart contains several valves that help keep blood flowing in the correct direction. One of the most important is the aortic valve. The aortic valve sits between the heart's main pumping chamber and the large artery that carries blood to the rest of the body. When it works normally, blood moves forward and does not leak backward. But if this valve becomes leaky, a condition called aortic regurgitation, some blood flows backward into the heart instead of forward into the body. Over time, that can place extra strain on the heart. The heart has to pump extra volume. The chamber can enlarge, the muscle can weaken, and eventually, this can lead to heart failure. What is fascinating is that significant valve problems can sometimes be seen from the outside. You may notice visible pulsations in the neck, not just a normal pulse, but a forceful, noticeable bounding movement. Some people can see tiny pulsations in the nail beds if they press lightly on the tip of the nail. This is called Quincke's sign. Some people may even develop visible pulsations of the uvula at the back of the throat. That is known as Mueller's sign. Others may notice the head subtly nodding with each heartbeat. That is known as de Musset's sign. These findings are uncommon, but when they are present, they can be important clues to significant aortic valve disease. Now, I do not want you staring at your neck in the mirror and scaring yourself over every normal pulse. Everyone has a pulse. That is not the issue. The concern is a bounding, unusually forceful pulsation, especially if it comes with shortness of breath, chest discomfort, fatigue, dizziness, or a heart murmur your doctor has mentioned before. Valve disease can be silent for a long time, and by the time symptoms become obvious, the heart may already be under strain. That is why clues matter. They give you a reason to ask your doctor whether your heart valves need to be checked. Often the test used is an echocardiogram. That is an ultrasound of the heart. It lets doctors see the valves opening and closing in real time. Number 6. What do your fingers look like? Your hands can reveal a surprising amount about your health. Try this simple test. Place your index fingers together, then place your thumbnails together. Look between the nails. Can you see a small diamond-shaped gap? Good. That gap is usually normal, but if the gap is missing and the ends of your fingers look rounded or enlarged, you may have a finding known as clubbing. Clubbing happens when the tips of the fingers become enlarged and the nails curve more than usual. The nail may look like it is wrapping around the fingertip. The angle between the nail and the skin changes. The fingertip may look swollen or bulb-like. This does not usually happen overnight. It develops gradually, and because it changes slowly, many people do not notice it until someone points it out. Clubbing is often a sign that the body has been exposed to low oxygen levels for a long period of time. Heart disease can cause it, especially certain congenital heart problems or conditions that affect oxygen delivery. But lung disease can also cause it. So can some infections, inflammatory conditions, liver disease, and other medical problems. That is why clubbing is not something to ignore. It is not a diagnosis by itself, but it is a clue. A clue that something deeper may be going on with oxygen, circulation, the lungs, or the heart. If you think your fingers may be clubbed, take a photo today, compare both hands, ask whether this is new, and bring it up with a healthcare professional. Do not let anyone dismiss it without at least thinking through the possible causes. Number 7. Check your eyelids. Finally, have a look at your eyelids, especially near the inner corners of the eyes. Do you notice yellowish patches? Soft, flat, yellow plaques under the skin? These are called xanthelasma. They are deposits of cholesterol-rich material underneath the skin. Xanthelasma itself does not mean you definitely have heart disease, and it does not mean you are about to have a heart attack, but it can be an important clue. It may be connected with abnormal cholesterol or lipid metabolism, and abnormal cholesterol is one of the major risk factors for atherosclerosis. Atherosclerosis means plaque buildup inside the arteries. Over time, plaque can narrow the arteries, it can reduce blood flow, and if a plaque ruptures, it can trigger a clot. That is how heart attacks and many strokes happen. So while xanthelasma is not dangerous by itself, it may be a sign that it is time to check your cholesterol. Not just total cholesterol. Ask about LDL. Ask about HDL. Ask about triglycerides. Ask whether your overall cardiovascular risk has been calculated. And if you already have yellow patches around your eyes, do not just cover them cosmetically and forget the bigger question. Your skin may be giving you a clue about what is happening inside your blood vessels. Now let's bring all 7 signs together. 1. You need multiple pillows or cannot breathe comfortably lying flat. 2. You become unusually short of breath climbing stairs. 3. Your ankles or legs swell, especially if the swelling leaves a dent. 4. Your pulse feels irregular or unpredictable. 5. Your neck or fingernails show unusual pulsations that could point to valve disease. 6. Your fingers show clubbing, which may suggest long-term low oxygen or cardiopulmonary disease. 7. Your eyelids show yellow cholesterol deposits that may point toward abnormal lipid levels. These signs do not automatically mean you have heart disease, but they are clues, and clues matter. They are the same kind of clues doctors use every day when deciding who needs more testing. The mistake most people make is waiting for the dramatic symptom. They wait for crushing chest pain. They wait for collapse. They wait until they cannot breathe. But the body often whispers before it screams, and these 7 signs are whispers you can actually check. Here is what I want you to do after this video. Tonight, ask yourself how many pillows you need. Tomorrow, notice how you feel on the stairs. Check your ankles at the end of the day. Feel your pulse for 30 seconds. Look at your fingernails. Look at your fingertips. Look at your eyelids in the mirror. This takes less than 5 minutes, but it could give you information you have been missing for years. And if you notice one of these signs, especially if it is new, worsening, or happening with shortness of breath, chest discomfort, fainting, dizziness, or unusual fatigue, talk with your doctor. Get properly assessed. Ask whether you need an ECG. Ask whether you need blood work. Ask whether you need an echocardiogram. Ask whether your cholesterol, blood pressure, and heart rhythm have been checked recently. And if you ever have severe chest pain, sudden shortness of breath, fainting, one-sided weakness, facial drooping, or trouble speaking, do not wait for an appointment. Call emergency services immediately. The earlier heart disease is detected, the more we can do to prevent serious complications later on. That is the entire point of this video. Not fear, awareness. Not panic, action. Your body may already be giving you clues. You just need to know how to read them. If you found this video helpful, please subscribe. Leave a comment below and tell me which sign surprised you the most. And share this with someone who might benefit from seeing it. It may help them recognize a warning sign they have been ignoring. I'm Dr. William Lee. Thanks for watching, and I will see you in the next one.